We're going to hear next from Larry Kalb, who's the president of Healthcare for All Washington. He's been educated and worked in France for 10 years in his history, so he has a very good experience of what good healthcare looks like, and he's been a tireless advocate for healthcare reform. He's currently employed at Wacom Transit Authority as a financial manager.
It's good to see all of you out here today. You know, when I was thinking about what I was going to say today, one of the things was, why are we here? Well, one of the most precious gifts in life that we have is good health. And who is going to stand up for that good health? You are. You have to. You have to stand up for yourself.
About that. I can't stand up.
Now Ted, of course, just said that he can't stand up. He used to be able to, but the thing is, this is a gentleman that we have to stand up for. This wasn't planned, by the way, but I'm glad you're here, because that's the essence of why we're here today. If we don't stand up for our health care, who can we expect to stand up for us? You know, we heard in Washington, D.C. the other night, our president, who says those who deceive or who really lie about what's in our health care policy, we're going to call you out. And we should. But we shouldn't confuse rejoinder with agency. And what that means is we shouldn't be reactive. We have to be proactive in our stance and in our approach. So what I'm saying here today is that we have to stand up for our health care so that we get the health care reform that we want. And then when we find our voice, I am sure that others will find theirs. And we have to make sure that when we have our voice, that we talk in unison with the same voice. That way we become a full community once again. And you know, I was thinking about Barack Obama's speech the other night, and I was hoping that he would say, "I pledge allegiance to the flag of the United States of America, and to that one nation, everybody have the same health care. Everybody get the same treatment for the same disease, for the same accident." Because the proposal that we have in front of Congress right now gives $700 billion to the for-profit private insurance companies over 10 years. That's right. I am one of the very few people that has actually taken the time to sit down and read the first 240 pages of H.R. 3200, which is called America's Affordable Health Choices Act of 2009. And in there's a provision that says we're going to give those people who cannot afford to pay for their premiums, we're going to give them a subsidy. We're going to give a subsidy to the plan. Gives a subsidy to the plan that prescribed the premium to their plan. So, in other words, it's a great bailout for the insurance companies, as if they really needed it. So, in other words, what's happening is that Congress has decided that we're going to get everybody excited about the public option, but they don't tell everybody, they don't tell the common, everyday working person that in order to get the public option, because the public option is not a standalone bill. I wish it were. I wish it were, because I would be out there 100% of the time saying we need the public option. But if we get the public option, that little bitty watered down program that it is right now, we're going to have these great big for-profit insurance companies taking over the market, which they call it the market. And these are the same people who have caused the problem that we're in right now. So what's the deal? The deal is we're going to have to stand up for ourselves. Now, when I lived in France, it was illegal for a for-profit private insurance company to interfere with a doctor's right to diagnose and to prescribe therapy. And when we revamp healthcare in this country, we should demand the same law. But I also agree with the right-wingers when they say they don't want the government involved. I agree with that. So when we reform healthcare, let's make sure that the for-profit private insurance company cannot interfere with a doctor's right to diagnose and to prescribe therapy. Let's do that.